So if you have a child who has what we think are repeated infections of otitis media, middle ear infections, then that's something that you can sometimes reduce the number of risk factors around that child to stop them from getting these infections. One way is to not smoke around them, even passive smoke. And some people say, well, I always go outside and smoke. Actually, that apparently is not good enough either. If you go outside, have your cigarette, vape, whatever you want to do, you have your cigarette outside, you need to change your clothes outside and have a shower outside before coming back in, because it's going to be in all your clothes and when you give your child a hug. So honestly, if you're worried about your child's hearing, you should stop smoking. And this may cause some arguments amongst parents out there, but the evidence is clear. If there's someone at home who passive smokes, even if they go outside and stuff like that, stop them from smoking, and it tends to get better pretty quickly. They don't get so many infections because smoke seems to reduce the amount of the activity of the cells cleaning themselves out in the ear and in the nose and things like that. And it really affects children quite a lot. So if you really care about stopping your kid from getting infections, you need to try and stop smoking. That's just an obvious thing. The other thing is how sometimes children, when they're giving their bottle to drink or whatever sort of juice or milk that they drink, they sometimes given the drink lying down flat in bed, so sort of drinking like this before they fall asleep. It's not a great idea, purely because the eustachian tube, that tube that goes from your ear to your nose, is in a slightly different angle when you're a baby boy or baby girl. And sometimes when you drink like this, it goes straight into the eustachian tubes, and you can get infected eustachian tubes because of the milk just pouring right down to the back of their nose. So just be a little bit careful of that. Try and sit them up at least 45 degrees rather than let them sleep on their back. Um, it seems to reduce the number of infections these children get, so sit them up as much as you possibly can. Now, there are things you can do also to prevent eustachian tube blockages and otitis media. Breastfeeding, I think a lot of people would prefer to breastfeed, but it's difficult for them. But if you can breastfeed, do breastfeed them for the first 6 months. That seems to help, 4 to 6 months. That seems to help with protecting a child's immunity and also eustachian tube dysfunction, protecting against that. There's also going to nursery. Now, it's pretty hard. And, you know, in this society, mums and dads are all going to work and kids have to go to nursery. But if you've got the choice and you're worried about your kids hearing, then if you don't have to send them to nursery, then it might be worth trying to avoid that as best you can until they've grown up a little bit, because once they're a little bit taller, bigger, the eustachian tube correspondingly is larger. It's less likely to get blocked. The same thing happens with flights. You know, when you're on an aeroplane and you're about to land, typically landing, sometimes taking off, all the kids start screaming because they can't pop their ears because their eustachian tubes are titchy and very small. They can't pop their ears very easily. And so they all start screaming because they get pain in their ears, and then they get infections and they ruin the holiday. So it is quite scary. So in these situations, do think about before you go on a holiday with small children, because there is a chance that it may cause real damage to their ears. Um, I'm not saying you shouldn't go on holiday, but just be mindful. Particularly if your child keeps getting ear infections, just be careful of that. You may cause them another infection whilst you're out there, or pain or suffering. I guess the other thing is vaccinations. Make sure the child is fully vaccinated, eating well, sleeping well, all those sorts of things. Good, healthy things that all mothers are taught to do.